This is FYI on your TV, brought to you by Hometown News. I'm Kathy Botham. I've got Debbie Small with me again. September is Brain Aneurysm Awareness Month, and you always join us in September to tell us your story and to bring awareness to this brain aneurysms to people that are listening. And not just people who are listening here. You are all about this the whole month of September. You get the word out there. So thanks for joining us.
Thanks for having me.
Let's talk about your story. When did it start, Debbie?
It was actually September of 2018. It was just a couple of days after my birthday when I had the rupture. I didn't know what it was when it happened. I had a headache, but it was like an instantaneous, felt like somebody had hit me in the back of my head with a bat. And I thought it was a very severe migraine headache. And so I didn't go to the hospital. I stayed at home, and I was like sick to my stomach. And just, it was an intense headache. I couldn't move. I couldn't do anything. I was just in a lot of pain. And it wasn't until I lost my speech to other people. To me, I was speaking normally, but my words apparently were very garbled, that 911 was called. And this was, the rupture actually happened on a Sunday, and it was the Tuesday morning when I went to the hospital. I had a CT scan done in the Smiths Falls Hospital, and they found the rupture and sent me to the Ottawa Civic. And once I was there, they did an emergency coiling surgery. They found 4 other brain aneurysms, and the first surgery I had was, I believe, 8 hours long to repair the rupture. And at first they said they would deal with the other aneurysms later on, but they decided to repair 2 other aneurysms while I was in the hospital at that time. So the following week I had a second surgery, and then the week after that I had a third surgery. So I was in the Civic for a month, the first stay, and then I came home. And then since then, I've had 2 more surgeries. During my second surgery, I had 2 minor strokes, which caused some right-sided weakness. Yeah, and I'm coming up on my 5-year anniversary of all that. Yeah.
And I remember you telling us before too, the fact that this happened on a Sunday and you didn't go to the hospital till Tuesday. You're a very lucky lady.
Extremely lucky, because time is crucial, and getting medical intervention immediately is crucial. And the fact that I didn't go to the hospital, it's actually a miracle that I survived.
Absolutely, absolutely.
Yeah.
And you're here to spread awareness and tell other folks about it too. So something I saw on your Facebook page, 10 to 15% of people diagnosed with a brain aneurysm will have more than one. Mm-hmm. And you had like 4?
I have 5.
5. The one ruptured and then 4 other ones,
yeah.
Right?
Yes.
Okay. So they must keep a close eye on you.
Yeah, I go in, and actually I just got my letter for this year's scan. I go in every year for MRI, angio with contrast, and they check all of them to make sure that I've had I've had 3 of the 5 repaired, and 2 that are being watched because their size, they aren't of a size that they will repair them yet. 2 of the other ones are still considered active because they're still taking in blood at the necks of the aneurysm. They have been coiled, but there is a little bit of blood going into the necks of the aneurysms.
Okay.
So the treatments that they do, I mean, they do endovascular coiling, which is what I've had done, and they do craniotomies, which is open skull surgery.
Mm-hmm.
It depends on the location of the aneurysm, and where my one is located is in the center of the brain, so it cannot be treated with an open brain surgery.
Okay.
So they've had to recoil that one because the coil's compacted, so they had to add more coils to it, but they can't do any other treatment to it because of where it's located.
Okay. Now, what kind of treatment or what were you having? I saw you having some kind of discussion with somebody who was losing their hair, but yours was in a perfect square patch.
Yes. CT scan is a type of X-ray, but it has a higher level of radiation. And they use CT scan during the endovascular surgery, which is the coiling surgeries, to help guide the surgeon in that repair. So you're exposed to a lengthier CT scan.
Like a dose of radiation sort of thing in one
Yeah.
spot? Okay.
So that's why you end up with these perfectly square patches of
Okay.
hair loss. So I ended up with like little patches of hair loss all over my head where they had done these, where the CT scan was placed. And I remember when I was first losing my hair in the hospital, asking the nurse, because I was noticing it when I was brushing my hair, and at the time my hair was extremely long, and she wasn't sure what was happening. And she thought it could have been a med that I was on at the time. And I was like, I wasn't on anything that could have caused that reaction. And it was my neurosurgeon who explained it to me.
Okay.
So even the nurses at that point couldn't answer the question. So yeah, and that's asked often in the group that I belong to, the hair loss question.
Is part of it. Okay. Now,
Yeah.
I know you do some physio and speech therapy as well, too.
Mm-hmm.
And that's
Yeah.
ongoing?
No, I finished physio and speech. The problem with that is there are so many people waiting to get into those types of therapy that they can only offer you a certain length of time, and then you're discharged from it regardless of if you're still requiring it. So they did extend my physiotherapy. I was doing it at the day hospital in Perth, and they extended it. I think I was there. My time frames are probably not the greatest, but for probably a year. And I know they extended it for me twice. And then I did do some home physio through the community care. and they set up a program for me that I could follow at home.
Okay.
And it was the same with, I did speech therapy and occupational therapy as well.
Okay. And I know we were talking before we started taping too about all the books behind you. You've been working on that too. You used to be a real avid reader.
Yes, I was previously, and afterwards, I have a lot of memory issues that sort of comes hand in hand with all of this, and it's very difficult for many of us to read because it's hard to remember page to page what you've read on the previous page. So you're constantly flipping back and forth and trying to keep track of the plot and the characters and what their role is in the book is extremely frustrating. And my first attempt at reading, I had a notebook beside my book, and so I was jotting down the characters' names and what they were doing in the book. So it kind of took the joy away from, what reading is supposed to bring you. And so I gave up on it for a couple of years. And so this year I did go to, like I said, I went to Arlie's bookstore and I picked up an author that I remembered, whose books had a fairly simple plot, theme, and fewer characters in them. And I did manage to get through one of her books, and I was like, yay me.
Yeah, good for you. Good for you. That's right.
So,
That's right.
yeah.
Now, I know I've asked you this question before, and I really can't remember the answer. Is brain aneurysms, are they hereditary?
They can run in families. There is different views on that. I was the first person in my family to be diagnosed with an aneurysm. Since my diagnosis 5 years ago, my sister she was in a car accident, and she was having a scan for something related to that. And during the scan, they found an aneurysm. And she ended up having a flow diverter put in, and she's fine. She had no deficits following that. And she's back to work, and everything's good. And then our youngest sister, because of that history there, she was advised to have a MRI done, and they found a small aneurysm with her as well.
Wow.
So there is I guess, like a genetic link there in families, but it's, yeah.
Oh, here it is. I knew I made some notes about this. Some brain aneurysms show no symptoms for years as well. So maybe that's what was happening with your sisters too. So it's good that they went and got checked.
Yeah, and it's like people can like, I had headaches for years and years and years. And like, I could have had a brain aneurysm growing for, a long time. And that could have been related to the headaches I was getting.
Right.
And then they grow into a point where there's no more room for them to grow, and then they rupture. It seems to be, what happens. But there are people that walk around for years and years, and they never have a problem, and will live their whole life not knowing they have one.
Well, you know what? I know you come here every September and talk to us, and we tell stories over again. But I learn from you each time, and that's one of my main takeaways this time was some brain aneurysms show no symptoms for years.
Mm-hmm.
Yeah, I'm always
Yeah.
learning. Always learning talking to you. Is there any resources for people where they can learn more if they want to learn more about this topic?
You know, it's
Other than your Facebook page.
yeah. Well, what we're trying to do is really raise awareness,
Yes.
because when you go into, you know, doctors' offices and places like that, you see things on, you know, breast cancer, and you see things on heart attacks and strokes, and um, you know, prostate cancer, and all these different things. You never see anything about brain aneurysms. And yet you will talk to people, or you'll meet somebody and they'll say, you know, my aunt had one, and she passed away from, or, you know, I knew somebody who had a brain aneurysm and they died, or, you know, it's not uncommon,
Mm-hmm.
but yet you never hear about it. And I mean, I didn't know what a brain aneurysm was, even at the time of my rupture. When I went to the hospital and they told me that I had a brain aneurysm rupture, I was like, okay, give me a prescription, send me home. You know,
Yeah.
like,
Yeah.
I had no idea what it was. And there just seems to be no awareness out there, yet it affects so many people. And it's deadly.
Absolutely.
And
It's far more serious than getting a prescription.
yeah,
Yeah.
and it does. And time is so important in the outcome.
Yes, you were very lucky. You are a miracle, that's for sure.
Yeah.
Yes, for sure, for sure. Well, I encourage people to take a look at your Facebook page, if you don't mind me saying so, because
Oh,
this whole
absolutely.
month you have posted stuff at least daily, sometimes a couple of times every day, learning more about brain aneurysms. And I know you've been on chat groups and other groups for brain aneurysms worldwide too, I believe, if I'm not mistaken.
Yeah, I belong to, actually, I'm an admin in a group that we have 14,000 members worldwide.
Wow.
It's a private group for aneurysm survivors and family members who have survived a rupture or who have a brain aneurysm. Um, and it's a wonderful support group for people who are dealing with a brain aneurysm. And there's, you know, caregivers who are dealing with a family member or a friend, or, you know, a loved one who are going through something like this right now.
Right. Well, I thank you for joining us here on FYI and sharing your story and bringing more awareness to Brain Aneurysm Awareness Month, which is September every year. And thank you very much for sharing your story. My friend Debbie Small, thanks for joining us again this year, Debbie.
Thanks for having me, Kathy.